All right. Well, that looks good to me. So as the title suggests and as Dr. Kufalstad, as Greta said, our presentation is going to be on acupuncture. And as most people know, it's used a lot in pain, but we're also going to be talking about some of the other indications as well as some of the latest and greatest in its use in surgical care. Next slide. So our objectives for this presentation are to demonstrate improvement in patient outcomes and cost savings using the various acupuncture applications of acupuncture. And hopefully at the end of this, if you aren't already familiar with making referrals for acupuncture, that if you do have a patient who comes interested in acupuncture you feel would benefit, that you do have the knowledge to comfortably make that referral. Next slide. So a brief overview of the topics we're going to hit. First, we're going to be talking about defining acupuncture, a brief history, and how it works. And then we'll be talking about the various indications, the evidence review for them, as well as its use in surgery, and then insurance and referral issues. And then, as some of you know, not every acupuncturist is trained the same, so different qualifications of acupuncturists and what the differences are. Next slide. So first, the origins of acupuncture. It was first described in the Huangdi Neijing, which loosely translates to the Yellow Emperor's Inner Canon or the Yellow Emperor's Inner Classic, as therapeutic needling. And this document was written in the ballpark of around 2,000 years ago. Although acupuncture was thought to have first been practiced well over 3,000 years ago, and originally they used bone needles. And over the centuries, in the various Chinese dynasties, the practice has evolved. And of course, in Chinese, acupuncture isn't called acupuncture. It was thought to have been first coined by the French Jesuit missionaries in the 1600s when they went to China. And it uses the Latin roots acus and punctura, translating from Latin as needle and puncture. And gradually, it spread from China to other parts of Asia into the Western world, and it was first documented in its use in the United States in the 1800s, but didn't really start gaining traction until more Chinese migrants came in the 1900s, and after in the 1970s when President Nixon established more diplomatic relations with China. Next slide. So I'll be briefly talking about how it works both from an anatomical and physiological standpoint, as well as from a traditional Chinese medicine standpoint with energetics. And so the anatomical basis, there's 80 to 90% correlation overlap between the acupuncture meridians, the lines that many of the acupuncture points lie on, and myofascial planes, the seams between the myofascial layers. And this is kind of further substantiated by some studies looking, injecting dye actually into acupuncture points. So there have been studies injecting technetium-99 into acupuncture points as well as sham non-acupuncture points, and they actually saw that the dye spreads kind of in along the meridian in acupuncture points, whereas in non-acupuncture points, it spreads radially as you'd expect, just in a circular pattern, diffusing out. They've also done histological analysis, biopsying acupuncture sites, and have found increased numbers of neurovascular bundles in these areas in many of the acupuncture points. Electrical conductance has been measured, and it's actually fun using a probe, an electrical conductance probe, and just running it along the skin. And on many of the acupuncture points, if you calibrate it right, it'll buzz only on those points and not over the rest of your skin. It's It's also been shown to release various endogenous opioids, endorphins, other neurochemical agents. And mapping, neural pathway mappings have also been done, both in the spine as well as in the brain with fMRI and PET scans. Next slide. This is just a slide showing just some of the various bioactive peptides that are released in acupuncture. Next slide. So these are some images, fMRI images. And so this was a study by Sun-Shik Yu in 2004 in the Journal of Neuroimaging. And it isn't a hallmark study or the most famous study by any means, but it is one of the earlier ones looking at the default mode network. So as we all know, even when we're resting, our brain isn't inactive, it's still active. And one of the active circuits is the default mode network. It's most active when you are in a restful awake state. So if you're spacing out or meditating, this area tends to light up. And it's in the mid prefrontal cortex and the cingulate gyrus. So you can see on the left side, labeled A, these two areas light up in healthy patients. These are our control patients. In B, in the center, these are chronic low back pain patients, and you can see that the default mode network is somewhat disrupted here. The activity is disrupted. Whereas in C, these are the same patients from B, but after treatment with acupuncture. And you see that the default mode network areas are lighting up, not quite the same as in the controls, but significantly more than in prior to acupuncture treatment. And actually, there have been many studies looking at fMRI and studies looking at brain activity with acupuncture. And they've looked at similar groups of patients, controls, pain patients, before and after acupuncture treatment, and in sham acupuncture. And the interesting thing about sham acupuncture, whether it's not needling acupuncture points or using pressure, is that there still seems to be some sort of therapeutic effect, suggesting that there may be some therapeutic effect just in the touch, or there may also be a placebo component. But depending on its indication, the level of activation in these areas of the brain are different from true acupuncture. And so other areas that people have looked at are the insula and amygdala, which are other areas associated with emotion and pain. Next slide. So I'll also be talking about the traditional Chinese medicine, some traditional Chinese medicine concepts. And it's a little bit of a disservice because you could easily have over a 100-hour course on or even more just on some of these concepts if you want to get into the nitty-gritty details. But these just kind of represent a different worldview and are often used by acupuncturists in designing treatments. Next slide. So first, yin and yang. I think many of us are familiar with it, and we're familiar with the symbol. And the symbol that represents, a balance, and oftentimes we think of yin and yang as good and evil, but it's really more broad than that. One of the ways I've heard it described that I really like is yin is the shady side of the mountain, and yang is the sunny side of the mountain. So on the sunny side of the mountain, it's closer to the sun, it's warm, it's bright, and what I really like about this is that it's dynamic. As the sun moves, which side of the mountain is sunny and which side is shady also changes, and one cannot exist without the other. They both always exist, and there's some sort of balance, and it is relative. And one comparison that some people like to make is also just like the parasympathetic and sympathetic nervous systems. There's kind of a balance between the two, and there are actually yin and yang aspects to those when you look at that system from a traditional Chinese medicine standpoint. Next slide. So the vital substances. So these are another framework that a lot of traditional Chinese medicine is, some of traditional Chinese medicine is based off of. And so this was several thousand years ago, before there are descriptions of electrons, of neurotransmitters, and uh, some of these have been tied in the modern day in Western, with the Western view on acupuncture and trying to describe how it works. Many of these do have that correlation, but we're not going to go into that. It's kind of outside the scope of this talk. But qi, some of you may have certainly have heard of, is life energy, and we'll talk about it a bit more in the next slide. But there's also shui, which is blood, jin, which is body fluids like sweat, tears, any body excretions, jing, which is life essence and can also be thought of as the genetic inheritance, and sheng, which is spirit, and it's best described as your mental health. And each of these have a yin or yang association, and is associated with going in moving through certain parts of the body. So Shun, for example, goes through the blood vessels and is centered in the heart. Much like how when we think about emotions, we think about the heart as well. Next slide. So qi, I wanted to talk a bit extra about. So the character you see here is the traditional Chinese form of writing for qi. And the upper portion means vapor or steam, and the lower portion means rice, specifically uncooked rice. And it really highlights this material and incorporeal sense of qi, and that there's a kind of fluid balance between it, from the solid rice to the immaterial steam that comes off of it. And this concept recurs in Chinese medicine, in that there's a dynamic flow of energy. And many descriptions of problems comes from the idea of stagnation and lack of movement. For example, edema or blood clots we can think of as stagnation of blood or stagnation of fluid. And many problems originate in Chinese medicine are described as stagnation of energy. And I really like this one saying from, according to ancient Chinese philosophers, life and death themselves are nothing but an aggregation and dispersal of qi, which really highlights that both corporeal and incorporeal sense of it. Next slide. So really briefly, the 5 elements model. So there are 5 elements in traditional Chinese medicine: water, wood, fire, earth, and metal. And they can each nourish or suppress one another. Kind of intuitively, as an example, water suppresses fire, whereas wood would nourish fire. And there's each of these have their own associations. Actually, on the next slide, there's a table that we have here. If we can go to the next slide. That kind of shows some of the associations with each of these elements. They have an organ association, a meridian, an emotion, sound, taste, color, and even neurotransmitter association. So for example, with wood, excess wood is often associated with anger, frustration. Its sense organ is the eyes. The tissue is, it's in your tendons. The yin meridian it's associated with is the liver. The yang meridian is the large intestine. Sour taste, loud shouting sounds, rancid smell, the wind element in climate. And then the neurotransmitter acetylcholine is associated with the wood element. Next slide. So kind of tying it all together, the point of acupuncture is to treat any imbalance. So a lot of ailments are either a stagnation or lack of movement in energy and qi, or an imbalance in one of these 5 elements. And so you can certainly treat with local treatments directly over pain, somewhat similar to dry needling or trigger point release, but there is such a broader system that you can design treatments around to promote energy flow or promote a better balance between the elements. Next slide. So before getting into the indications of acupuncture, I wanted to talk about a brief patient case. A very typical chronic pain patient here, a 69-year-old obese male with a 2-year history of low back pain radiating into his left leg. And over the 2 years, it's been progressively worsening and now is radiating into his right leg as well. And he complains about being too stiff to get out of bed in the morning, not being able to do his daily activities, any prolonged posture in any position, sitting, standing, or walking for more than 10 minutes causes severe pain, and he has to change his position. And he's tried several rounds of physical therapy, tried Tylenol, NSAIDs, muscle relaxers, topicals, all of which have provided some relief, some dulling of the pain, but nothing that really lets him get back to his daily activities or is long-lasting. Imaging has shown moderate degenerative changes in the lumbar spine, both on X-ray and MRI. And so he's asking, what next, doc? And you don't want to start a narcotic because it is because of its potential for addiction and tolerance. And fortunately, this patient ended up making it to me for acupuncture. And so I usually like to counsel the patient on what to expect. So I usually tell patients if they aren't seeing me or if they're seeing a different acupuncturist, that they can ask them, what their expected response time is. I usually say give it 3 or 4 treatments because there are different ways to approach each case. Just because they didn't have a reaction to one treatment doesn't mean we can't approach it from a different standpoint. And any reaction I say is a good reaction. So some patients initially experience a bit more pain that day, and over the week experience some reduction in pain before it comes back. And so this kind of happened with this patient. After his first treatment, he felt a little bit more pain, but by the next day, he felt the pain was about 20% better. He followed up with me in a week, and after a second treatment, he felt his pain was about 30% better, lasted about 5 days. By his third treatment, he was 50% better from his previous treatment, lasted the entire 2 weeks to my next follow-up. And by then he was already asking, so how many more treatments do we need? Because he was getting out of bed, feeling fine, and doing all of his daily activities again. And, during this time, I'm still advising him to continue all of his physical therapy exercises at home. So it's not a one or the other. You can do all of these in conjunction. And so this is kind of I'd call it a relatively typical success story in a chronic pain patient with acupuncture treatment. Next slide. So brief evidence review and indications for acupuncture. So before we get into the specific indications, there's been a lot of evidence showing the safety of acupuncture. So it's non-addicting. There are very few side effects. It's safe in pregnant women and patients on blood thinners. And the biggest concern, the biggest kind of adverse event would be a pneumothorax. And the incidence of that is somewhere around 0.5 to 1.5 cases per 1 million, depending on which country you look at in its practice. So it's incredibly rare. And most of the pneumothoraxes are extremely small and self-resolving. So the indications here, this slide specifically was made from the Australian Acupuncture and Chinese Medicine Association in 2017. But there are several other bodies that have reviewed the evidence of acupuncture, and a lot of it is very similar in what they've concluded. So there's a pretty strong evidence for acupuncture being of benefit for various pain indications. Not all pain is the same. So specifically for low back pain with chronic headaches, migraines, post-operative pain, and then also with post-operative nausea and vomiting, allergic rhinitis, chemo-induced nausea and vomiting. And the list goes on for indications where there's moderate evidence for potential benefit of acupuncture. And this includes shoulder pain, tennis elbow, neck pain, as well as other indications like premenstrual symptoms, various psychological ailments, depression, anxiety, substance addiction, specifically to smoking. So the the literature, it can be difficult because, as I mentioned earlier in the fMRI studies, even when you do sham acupuncture, sometimes you get some sort of response. And so a lot of the indications with moderate evidence, there's still plenty of potential for benefit where they see benefit from acupuncture, but they also see benefit from some of the sham acupuncture treatments. One thing I also wanted to highlight here is the cost with acupuncture. So it certainly can be cost prohibitive for patients if acupuncture is not covered, and we'll talk about cost and insurance a bit more later. But insurance specifically, estimates have been as low as just 50 cents per patient per policy for to add acupuncture benefits to insurance. And I'm sure Kelly may have more things to say about that with her involvement in the promotion of acupuncture. And I'll actually transition here to let Kelly talk about some of the evidence in acupuncture for pain and other indications.
Thank you, Larry. Okay. So I'm going to just transition, thank you so much for showing the context, both from a Western and a traditional standpoint about how acupuncture works. And happily these days, there's a lot of research being conducted about that has generated pretty strong evidence base for acupuncture. So we're going to focus the rest of this talk particularly on issues related to pain generally, and then as well as pain related to post-operative intervention. So agencies and policymakers at the state and federal levels have advised or mandated that healthcare systems and providers offer non-pharmacological treatment options for pain. Obviously, a lot of that comes from some of the pitfalls that are associated with opioids. Acupuncture has emerged as a powerful, evidence-based, safe, and cost-effective treatment that's immediately available. So it's very suitable. So it's both really advantageous for patients, but it's also very advantageous for providers who are seeking alternatives for the patients that they care so much about. So, this is just a list of the agencies that have supported or confirmed the benefit of acupuncture. Many of these organizations have set and created policies that have increased utilization of acupuncture. They have opened the path for more insurance coverage. And so we're going to go into that a little bit more. As you may know, Medicaid now covers chronic low back pain under certain circumstances. And at some point, whether in the talk or after the talk, if you have questions about that, we can go into that more specifically. So just two pieces that I wanted to highlight just to see how this is all sort of rolling out in real time. So the Joint Commission made the following recommendations based on the American College of Physicians evidence showing that acupuncture is a very effective treatment for lower back pain. So we have sort of from the top recommendations coming from the Joint Commission, and then to follow that, the National Association of Attorneys General they wrote a letter, and specifically their recommendation is for the Americans' health insurance plans to take proactive steps to encourage members to review their payment and coverage policies and revise them as necessary to encourage healthcare providers to prioritize non-opioid pain management options, naming acupuncture so specifically. So obviously you can see all of the different stakeholders, all of the different parts in our system that need to coordinate to enable more patients to receive acupuncture for pain. And so, you know, one of the first places that we started seeing this, particularly policy level, was at the state level. Several states started rolling out Medicaid pilots. The states wanted to measure the effectiveness and the cost effectiveness of using acupuncture. So the next couple of slides are from the Vermont Medicaid pilot. And you can just see that in general, the result was that using acupuncture reduced pain medications and opioid prescriptions. So before acupuncture, 72% of people were using medicine regularly for pain, and 43% reported that they had side effects related to those medications in addition to pain relief. And after acupuncture, 57% of the group was able to reduce their utilization of pain meds, and both non-narcotic and opioids. So these are all obviously very encouraging findings. The other piece, of course, because you know these programs are coming through the workplace analysis, trying to help people return to work. Work and productivity increased when acupuncture was included in the care plans. 97% of people with chronic pain said that it interfered with their ability to work. And after acupuncture, up to 59% of the group had improvement in their ability to work, and 21% reported no change in their ability to work. So data and pilots like this have facilitated Medicaid coverage in multiple states in the United States. Wisconsin currently does not have acupuncture coverage in its Medicaid program. However, there has been legislation introduced that would include acupuncture for pain management. And so I would say that in the next couple of years, we can follow that. And I think there's a very good chance that we'll see that in our state as well. So some of the highlights, right? So acupuncture reduces prescriptions and the amount of opioids needed. Some of these data points come from a huge review, a white paper, Acupuncture's Role in Solving the Opioid Epidemic. As a profession, the acupuncture profession's been very active in advocating for the use of acupuncture, both at a national level and at the state level. If anyone in our audience would like a bibliography of all the compilation of evidence, I'm happy to provide that. One of the most exciting findings was showing that patients responded to acupuncture faster than morphine in some cases for acute onset of moderate to severe pain. So that opens the door for the potential to use acupuncture in the emergency room setting when that's appropriate. As Larry pointed out, we know that acupuncture activates the body's own opioids and natural anti-inflammatory compounds. That's one of the mechanisms. And that acupuncture consistently shows a reduction in the consumption of opioid-like medications, both following surgery and, what's great about some of the research being done is that it's showing the long-term effects. So these are results showing pain reduction that was consistent for up to 8 weeks following a surgery, for example. As Larry pointed out, one of the lovely things about acupuncture is that it doesn't have very many side effects. It's non-addictive, and since as a society we're trying to use opioids as necessary, but not rely on them, not overly rely on them. There are patients who have had wonderful pain management from the use of narcotics who are now in a position of weaning off of them or using less of them or having to find alternatives. Well, acupuncture, although it can help with pain management, it can also really support those people through their experience of withdrawal and cravings. A lot of this understanding of using acupuncture specifically in a drug and alcohol related context comes from work that was done several decades ago in New York in a hospital where acupuncture, auricular acupuncture, which is using acupuncture points on the ear, a protocol was designed to help with drug and alcohol withdrawal. One of the really fascinating outcomes of that work was that many of the people in the program started showing other positive results, such as better sleep, less anxiety. Many people in those populations had experienced trauma. So there was significant, it was almost like positive side effects from using acupuncture in addition to helping with withdrawal. So I always like to highlight this because it's definitely a twofer, I would say. So we can treat pain and addiction at the same time. One of the other seminal areas that shows acupuncture effective is in the reduction of nausea and vomiting. We know that preoperative acupuncture can improve post-operative outcomes. So, you know, as you may know, many patients rate nausea similar to or worse than pain in terms of their own personal experience. And this study, as well as several others, has shown that acupuncture prior to surgery significantly reduces nausea. The evidence base for acupuncture supports its use for routine prophylaxis of post-operative nausea and vomiting with antiemetics or as an alternative to them, depending on what's appropriate for that patient. Many times, if there's acupuncture being given preoperatively, one of the best ways to deliver acupuncture in that setting would be to use auricular acupuncture. Again, that's utilizing acupuncture points that are on the ear. So as you can imagine, those are really easy to get to. It's possible to give those treatments immediately before surgery. Many of the studies that are looking at using acupuncture during surgery utilize auricular points because, again, they're easy to reach. That wouldn't interfere with the other activities during the surgery. I love this slide. So I wanted to include this because it's got, you know, nice images. It shows you the meridians. This is from a teaching module from the American Association of Nurse Anesthesiology. So, you know, so providers are looking for ways to help their patients with nausea. And one of the classic acupuncture points you see in the photograph is called P6. It's, you know, it's a point, many of you have seen it. There are these things that have been available in stores for a long time, like it's like a little stretchy bracelet with a hard bead on it. They're called C beads. They're supposed to be for people with motion sickness or seasickness. So this point is, you know, fairly well known. At one point, I was able to give a little in-service to a group of nurses who were wanted to get some insight about how to use acupressure to help with anxiety prior to doing biopsies, because so many patients are understandably very anxious at that time about what they may be facing, as well as the procedure itself. So what's really lovely about this point is that you can, you know, you're essentially almost holding hands with somebody. Like, it's a very easy place to touch when you're feeling the pulse. But so this is part of what the nurse anesthesiologists may be learning to help with nausea in their patients. And I just couldn't help but point out in figure 2 that acupressure imaginary meridians. So I just let that go. We don't think of them as imaginary when we're practicing acupuncture, but I thought that was kind of funny. Here we go. There's quite a bit of evidence that acupuncture can calm anxiety. And of course, there can be an association between less anxiety and less pain. So anxiety in the preoperative stage is often correlated with increased pain. And so as we utilize acupuncture to help patients with their anxiety, research is showing that they have a reduced need for pain management through their experience. Reducing anxiety obviously is important for pain management, but it really improves a person's quality of care. Just for them to acknowledge their anxiety and just to do something to try to offer them some support and calm goes a long way. Okay, so we're going to transition. There's a lot of really exciting things happening with the integration of acupuncture into surgical care specifically. I'm going to talk about a couple of programs and some studies. These are looking specifically at total joint replacements. So in the arena of total knee and hip replacement, there are ongoing programs that integrate acupuncture. One of them, some of the data I'll present are from studies. The two programs that I have looked at most specifically are the Connor Integrative Health at University Hospitals in the Cleveland area, as well as this research has been coming out of the University of Minnesota for many, many years. This diagram shows some of the common points that are utilized when you're working with the knee. And the general approach for much of what this research was looking at was providing acupuncture immediately post-operatively in the other knee. So we're not inserting needles into a knee that's freshly been sutured. We're able to do acupuncture in the other knee, so that should be comforting. And just as you all know, in your own practices, there may be generally helpful standards for care. That's true in acupuncture too. There are acupuncture points that are generally considered to be helpful in reducing inflammation and blood circulation and infection prevention. That would be generally suitable for people that had had joint replacement. And so those are the kinds of protocols that are utilized when we conduct research, right? Because we need to have a standard we need standard methodologies and replication to be able to say something about that. But at the same time, there are cases where, different points could be used because that would be more, that may be more effective for certain people. I'll just say that in the at the Connor Integrative Health program, what they've done, and I don't have data slides because they're still collecting their data, but in general, what they have been able to see is that inclusion of acupuncture into the total joint replacement has been successful with clinically significant improvement in pain starting on day 0 and robust improvement in stress and anxiety. The patient's perceptions of acupuncture was very high, and combined with the general perceptions by the staff, the pilot study has been very successful in helping people manage their pain, manage their stress and anxiety. And just generally, they just felt like the integration of the acupuncture was a really positive step for their general quality of care. So acupuncture during knee replacement surgery is really fascinating. Again, this is using auricular acupuncture because the ear is relatively available. So needles were inserted into 8 points of the ear. In this case, the study was looking at 41 patients. 65% of the acupuncture group was able to do a low dose or opioid-free post-operative care compared to 9% of patients who did not receive acupuncture. And in this case, of those with a positive response, 57% used 15 or fewer pain pills and 7.5% did not need opioids at all. This other program is a little bit more of what I was describing in the beginning. This is utilizing acupuncture needling on points on the non-operative leg, so knee or hip. So this is a study looking at 1,868 out of 2,500 patients utilized acupuncture. Of the 41% who had severe or moderate pain prior to acupuncture, 15% reported pain after acupuncture. So these results are somewhat consistent that we're seeing that the integration of acupuncture can reduce pain and the need for opioids. In this study, so and also with what's happening at Connor, what I think is fascinating is that the acupuncture is being integrated immediately post-operatively. So in these cases, there is usually at least some brief hospital stay with a total joint replacement. And right now it's standard of care that there would be physical therapy provided following surgery. So what these programs are doing is they're integrating group acupuncture following the surgical procedures. So depending on how long the person is in the hospital has some bearing on how many acupuncture treatments that they receive. But in the Minnesota study, they were having 2 sessions of group acupuncture available morning and afternoon for every day that the person was still receiving care. And then there was also the opportunity for individual acupuncture in cases where they may have other things going on in addition to pain. And I'll just talk about that briefly. Oh, this slide is just to show you that, as acupuncturists, we want to collect data too. We want to be as objective as possible. The American Society of Acupuncturists has put together this little card that, many of us have these in our treatment room. So we try to help our patients express to us, what their needs are, what their pain levels are, so that we can monitor change over time. For those of you at the UW system, you may see acupuncture notes in the patient charts. So we're trying to capture this information in a way that's really useful and easy to report. The main thing from my contacts at the Connor Integrative Health Program, we're just talking about how important acupuncture is for enhanced recovery after surgery, which is a really, obviously very important consideration, both for patient experience as well as cost. So, this slide is not about acupuncture per se, but it really shows that the incorporation of ERAS strategies can have a dramatic impact on some of the post-operative issues that people have. And acupuncture, in many cases, is able to treat a lot of these things, as we've talked about, post-operative nausea and vomiting. And so there are times in these programs where patients may be going to group acupuncture for a particular protocol to help with recovery, but they could also have specific treatment if they need that. There may be patients who aren't able to move their bowels following surgery. Acupuncture can help with that. Acupuncture can help them urinate. So there are really interesting ways to apply acupuncture, both in a general pain management strategy, but also with very specific treatments to help individuals, to help them progress and not come back and be readmitted after having surgery. Gosh, I'm going to transition to Kathryn Coppola, who's going to be talking about some of the considerations for coverage for acupuncture as well as referrals, and then we can all come back together at the end for questions.
Thanks so much, Kelly. So as Kelly and Larry both alluded to earlier, increased access to acupuncture is needed. Currently, what's going on is that acupuncture is covered by the military through the VA and the Department of Defense, as well as private insurance coverage. It is limited and it is increasing. However, most patients still end up paying out of pocket. So a study was done showing that 1 in 67 adults in the US report getting acupuncture on a yearly basis at least, which is up from a decade ago. And all of that despite only about a quarter of them saying that insurance covered their fees for acupuncture. And as Kelly mentioned earlier, Medicaid coverage, there's legislation to have it covered, and hopefully in Wisconsin we will have that. And there are several states already that do have Medicaid coverage for acupuncture. Medicare covers acupuncture for low back pain, and legislation is pending to have acupuncturists considered as Medicare providers. So what that means is, although acupuncture can be covered for low back pain, in Medicare patients, acupuncturists currently aren't able to provide that service yet. But again, that legislation is pending, so hopefully we'll see that soon. So let's look to more specifics. Next slide. So the Department of Defense Pain Management Task Force recommends multidisciplinary approach, including acupuncture, which is why all veterans' medical care plan includes acupuncture. The veterans are authorized 8 or 12 treatments in a specific amount of time to be able to use. And Veteran Health Affairs employs licensed acupuncturists, and they're the largest health system within the US, and 2/3 of military hospitals and clinics have acupuncture as well. Then with the private sector, next slide. So each private insurance company is different. So we'll look at Quartz as one specific example. Quartz's senior preferred plans cover 12 treatments a year with a copay. Now only for certain diagnosis codes. So these are the ones that have showed more improvement in the studies that we spoke about earlier. So Quartz patients with the senior preferred plans can get acupuncture treatments for migraines and chronic tension headaches, chronic neck pain, low back pain, knee pain due to osteoarthritis, fibromyalgia, myofascial pain, and nausea due to chemo and pregnancy. So those are the coverages, and as you can see now, most patients end up paying out of pocket, and again, each location is going to be slightly different. So within the UW health system, can we go to the next slide? Out-of-pocket fees for outpatients are $100 for the initial treatment and visit, and $85 for follow-ups. Then for inpatient, that fee is $70 a visit. Now, prior to the pandemic, there were 2 hours a week on both B66 and F66, where patients could receive acupuncture and those fees were covered for the patient. So that's kind of fees and insurance. Now, both Kelly and Larry alluded to the different training and who can provide acupuncture. So in the state of Wisconsin, the licensure, in order to receive acupuncture licensure to be a licensed acupuncturist, someone must graduate from an accredited program with 1,900 hours and 660 of those hours being supervised clinical hours. Also need to pass a national board exam, be certified in clean needle technique, and continuing education requirements. So this way, it kind of sets the standard across the board. Each state has different requirements, although they are very similar from one state to the next. Next slide. So although physicians in the state of Wisconsin aren't required to have any additional training in order to practice acupuncture, the American Board of Medical Acupuncture does have a certification process for those wanting it, which includes course study and education, clinical supervised training, as well as an examination. So we know that acupuncture is great, it does wonderful things. Access is still needed, and there's a lot of education around who is doing the treating. And thank you for being here and listening. We are all very excited to see acupuncture continue to grow, continue to improve patient outcomes, patient care, and more importantly, the patient quality of life. So at this point, I'm just going to open it up to questions.
Thank you all. I have a question about, as I think about different populations that receive acupuncture or different populations that don't receive acupuncture, does any of the data that, and some of the things that you presented, especially around like pre and post-op acupuncture, have there been studies to look at sort of patient expectation about acupuncture or familiarity with acupuncture and then its efficacy, or is that something that still needs to be studied?
Well, I can't answer your question specifically, Greta. I do know that there have been studies on that, and I, didn't include them here. But I guess one thing I would make an inference about is, for example, in the total joint replacement study, 76% of the patients that were undergoing that surgery who were asked if they wanted to receive acupuncture, 76% of them said yes. And so, you know, it's just interesting, I think, if you read between the lines with many of these programs where people are enrolling into these experimental groups voluntarily, that the percentage, that the interest is consistently fairly high. But I think that would be that'd be a great thing to look into.
Yeah, yeah. I think about this has got me very excited about thinking like, oh, who is our partner in ortho that would be willing to do to have our have a trial of patients? You know, I'm thinking about the American Center and that sort of thing. Like, but I'm just sort of wondering, you know, in our work to try to make sure that everybody has equal access, you know, that education campaign about what acupuncture is and its potential benefits, I think would be key going forward.
Well, in terms of access, you know, I will say that my contact at the Connor Integrative Health Program, you know, we talked a little bit about that, like particularly the logistics for doing preoperative acupuncture it's kind of steep. I mean, it's possible, but you know, you have very early surgeries going on, so you need to have somebody available to do pre-op, you know, at the right time for those people and kind of get them going. And there's so much else going on at the preoperative stage, but also not all the patients that are coming in for a total joint replacement, they have some insurance coverage for that procedure, but their policy may not particularly specifically have coverage for acupuncture, and so the associated costs for integrating the acupuncture are often, you know, covered programmatically by the provider, by the hospital system, to ensure that there's equivalent or, you know, somewhat even access for people. Also, just having to do pre-authorization on acupuncture for those with coverage in that setting is a little difficult. So I think one of the most important ways to consider, you know, that there's access is through those cost measures and application of funds and programs, just to make it a standard of care under the protocol of the surgery itself.
Thank you. I think Mary Ellen put in the chat that she's out of town, so unable to ask herself, but she was wondering about a website that you might recommend to search for a qualified acupuncturist.
Yeah, so there's two. So as Kathryn's slide showed, we have a national certification board. It's called the NCCAOM. And if you go to that site, it would just be like the National Board Certification of Physicians. So you can search for nationally certified acupuncturist state by state. So if you're looking to make a referral in another state, that's a really great option. The acupuncture profession also has state associations, just like the AMA. We have the American Society of Acupuncturists. So state associations will often have a directory of licensed acupuncturists that are active in that professional organization. So those are two places. But I would just say that in every state in the United States right now, I think there's two states where there isn't acupuncture licensure. You can be confident that anyone advertising as an acupuncturist, right, if they're state licensed, that they are qualified according to all those licensure rules.
What was the nationwide organization again? I want to put the websites in the chat.
Oh, okay, yeah. It's nccaom.org. I'll double check it here.
Nope, I got that one. What was the second one?
And in Wisconsin, I think we changed our name recently. I'll add the Wisconsin Association website in the chat. It's acupuncturewisconsin.org. You can also find a directory of members of the Professional State Association. And then there are
I-
physicians who are trained in acupuncture. I don't know, Vinny and Larry, how do they find physician acupuncturists?
You know, I'd have to get back to you on that. I know there is a database, and there's a society, and I think that they are searchable. But I don't have that off the top of my head.
Yeah, I believe it's similar to the NCCOM, where the American Board of Medical Acupuncturists has a database. I can search that and get that in the chat here.
I just saw David Kiefer put a question in the chat. I'll just read this. Sometimes patients are afraid of needles, and so he'll mention the option of acupressure, tuning forks, or auricular acupuncture. Can we say that licensed acupuncturists mostly know those options? I would say that's generally true. Auricular acupuncture sometimes has a stronger sensation than body point acupuncture, so that's something to be aware of. If you think that if you're wanting to refer somebody to acupuncture, but you think that they're very sensitive or they have a low pain threshold, auricular acupuncture may be felt more strongly. So that's just something to know about. But we have acupressure tools we can use instead of needles for people that need that. The only thing is that if you're billing insurance, then the needle has to be inserted through the skin to qualify as being acupuncture. So that's just something that's kind of an interesting logistical consideration. But there are ways to serve patients who are needle shy for sure.
I'll also add to that, when we say needle, a lot of people actually picture a syringe for an injection, and the needles are incredibly tiny. I tell patients they're about the size of an eyebrow hair, and for a first patient appointment, I always show the needles to the patient and how tiny they are. Now, not everybody has their patient breathe with the insertion of the needle, but that can also help so that patients don't end up feeling it. Or it's very minimal. It just feels like a quick bug bite and then it dissipates. And so this is not a no pain, no gain type of treatment. And so I like to tell patients that as well, so that once the needles are in, they shouldn't be feeling the pain of the needles anymore. And a lot of people don't feel anything after that quick 1 second insertion, if they even feel that. And the other thing that I like to tell patients who are a little nervous about it is a lot of times we don't necessarily put the needle right where their pain is. So if they're having right knee pain, we're not necessarily going right into that knee as well. And so all of those things to help to bring patient uneasiness down a little bit. So those are other things that can be mentioned as well.
Yeah, and I saw Linda Park wrote that I know there are extra fine needles, and that is true. There are different styles of needles. Actually, different schools. You know, if you look in Japan or Korea, and their styles of needles tend to be a little bit thinner or smaller gauge than even most of the Chinese needles, and the ones that are used for the ear are also much thinner as well. You don't have to use them only for the ear. You can use them anywhere really. So. That is also true. Although, oftentimes, as Kathryn said, you know, depending on how you describe it to the patient and how your technique with the needling, oftentimes you can, for patients who are needle shy, you can certainly make it very untraumatic.
And I just think it's worth speaking. And this is just I'm so glad this came up because it's such a common issue. One thing I'll say is that, and I think Amy Crickler wrote this, I mean, I personally don't ever use tuning forks, so I don't know that that is ubiquitous across, you know, what acupuncturists offer, although I think acupressure could be. Also, we have these really great tools these days. They're called Pionex press needles, and maybe you've seen them, but they look like a little, you know, the little circular Band-Aids that you put on a finger. They're that shape. They have, I don't have the specs, but they have a tiny little needle tip on the inside, and there's a little plastic bubble that holds the tip off the skin. And when I have some that are so small that when I push them against my finger, I can't feel anything sharp. And so, and then you can step up, you know, in size of those so that maybe the largest ones, if you push it against your finger, you would feel something. I think these are really wonderful. We often use them. I use them in pediatrics because, you know, if you have a toddler coming in, they're not going to lay on your table and like listen to relaxation music. They're going to want to move around. And the other thing is, I will say this for people who may be scared of needles, you know, acupuncture is really very, very good for people with anxiety. And I work with a lot of people who are, they are not comfortable laying still prone for any length of time due to anxiety. Some people even have what would be called like trauma related to procedures, things like that. And it's really lovely that these days you can give somebody an acupuncture treatment using these Pionex needles, which means that they can move. They can be told that at any time they can get up, they could sit up, they could move their body. I think that's really important from a quality of care perspective for people who anxiety or afraid of needles. Those are kind of new, so I just wanted you to know that those are out there.
I think Linda had a question that we missed earlier. Can acupuncture help with neuralgia? And so for neuralgia, it doesn't fall into that category of very strong evidence where study after study after study says, oh, it definitely helps. But it certainly can be used for neuropathic pain or neuralgia. And there are many different techniques as well in both from an energetics standpoint on treatment as well as with electrical stimulation. But at least I think one of the studies I saw recently on, specifically on herpetic neuralgia, was it was compared to medications like gabapentin to treat it, and it was pretty comparable with the relief that the patient experienced.
And I'll just speak into this, and I'll do a lit review for published research on this. But I will say, when I started seeing patients at the cancer center, I was already super biased that acupuncture is wonderful going in. I had no idea the impact that an acupuncture treatment could have in real time on post chemotherapy related neuropathies. There have been many, many cases where during a treatment, a patient will have increased sensation in their limb. And what we see in those cases is that while they're undergoing treatment, that pattern's going to continue. The neuropathy is going to present, and then the acupuncture treatment may help it get better. And then as soon as they have another infusion, it's going to come back. But we've seen over time with many patients that if they're undergoing acupuncture while they're undergoing the oncology treatment, that it doesn't the likelihood of the neuropathy becoming a permanent condition is much less if they've had acupuncture during the way. So that's one thing I will just off the cuff just say, I do have patients come in saying, I've been told that that the neuropathy isn't really going to change. And I've just really witnessed that can be a really strong effect with acupuncture. So that's good to know.
Sarah had mentioned in the chat that you were talking a little previously about experience of pain and the different maybe techniques that practitioners use. Some like to twist the needle deeply until they feel the pain. And I think I've been told that's touchy, but that tends to be for Sarah was more anxiety provoking, the gentler technique. Do you have thoughts about how different acupuncturists might approach that concept?
I mean, there can be quite a lot of variation. I want others to speak to, and Amy Crickler may be here, and she could certainly comment on her experience. My training, I think different lineage, just like many other modalities, different lineages stress different components of treatment. There are lineages that do not associate a strong sensation with an improved result. And so there are traditions in acupuncture that train acupuncturists to, in themselves, be able to discern changes in the movement of qi, or changes in the patient, objective findings and changes, without the patient having any sensation of the needle. I think there's quite a bit of variation around that, so we can probably only speak to what we know in terms of our own training.
Yeah, it is. As Kelly said, I think different schools and different lineages of acupuncture. It's over the millennia. Historically, if you look at it, every single dynasty that comes along, there's an evolution of acupuncture where there's probably a different branch of how it's developed. And so, in the Helms medical acupuncture course, it is taught to get the De Qi, essentially where you needle until you get this dull ache. But it is also not a hard and fast rule that you have to elicit this response for every and make the patient have this dull ache for every single point by any means, especially in patients who are needle shy or a little more adverse to pain. You really may not be going for this.
Thank you. Mary Pat was wondering if there's any evidence, if you have acupuncture the day before surgery, that you still have the post-op benefits. In Healing Touch, they like to do a pre-surgical session and a post-op session also, and clients see benefits. So thoughts about that?
The study that I reported on was immediate application of acupuncture immediately before surgery. So I guess I can't speak to that based on my prep for this talk, but I'd be happy to look into that for you.
I just think it might be something interesting because it really works. I mean, I think that it gets the qi flowing. And I mean, I know personally, I love acupuncture, and I would try to set up an appointment with my acupuncturist because the hospital visit is so busy. I would think that as long as you get it in 24 hours before, it would probably keep you. I would bet it would be proven if they tried it.
Yeah, I think in private practice, I think maybe others do this as well. We will often see patients prior to a surgery because it will just help them. It'll help them have a better night's sleep. It'll just help support them neurologically as they go into the procedure. Sometimes we'll see people not immediately following, but when they're up and ready and able to come back into treatment. And there's, people often report that has felt beneficial.
Thank you.
We're seeing folks in the chat comment on benefit of acupuncture for allergies and scar tissue pain, as well as urinary incontinence. I'm imagining that acupuncture for pain right now, and Western medicine's attention towards acupuncture for pain right now is largely driven out of the opioid crisis and the challenges of managing chronic pain. Do any of you have thoughts about your favorite success stories about non-pain that acupuncture has helped with?
I'll tell a quick story. I have seen some, I think the reason I talked about those Pionex needles is that I have had a fair number of patients referred to me by psychologists that work with patients that have been diagnosed with PTSD, sometimes for many different reasons. And so these are people who often have a hard time sitting still and going to appointments and things like that. And one of the really fascinating outcomes that we've been seeing working together is that sometimes patients will take anti-anxiety meds prior to their therapy appointments just to help them stay present and do the work when they're working with their mental health provider. And we've seen really wonderful outcomes of people having acupuncture the day of or the day before doing psychotherapy, or the day before having to go do a medical procedure, or having to do some sort of activity that would trigger their very strong PTSD symptoms, showing up and just moving through the experience very smoothly. And I find that really fascinating and, outside of the pain threshold, the pain conversation. What about others?
So for me, I work regularly with a 70-year-old woman who gets infusions, and I can't remember the name of the medication. She gets them every other week, and it really knocks her out, the infusion. She gets severe nausea afterwards and sometimes migraines, and just feels like her whole body's been hit by a truck. But as soon as she gets in and we start getting like the first set of needles in, she reports that she just feels so much more like herself, and she had kind of given up on feeling like she could have any control of her life because these infusions kept coming every 2 weeks. Um, and she's just a great example of, how it can integrate really well. She'll get the infusion, and then the next day she comes in for her appointment with me, and then she can move on with her life for 2 more weeks until her next infusion. Um, and so I've enjoyed working with her, and she's found a lot of benefit from the treatments as well.
Yeah, not a success story, but a success experience. I myself, one of the reasons I have had the interest of going into acupuncture was in medical school. I went to China. There's, there were a couple days where there was really bad air pollution, and I had completely clogged sinuses, couldn't breathe at all. Had an acupuncture treatment, relief that 5 minutes after the treatment, and it actually lasted for the entire duration of while I was in China. So I wasn't there for that. I got it midway through. I was there for 4 weeks, and I think I got it on week 3. But it was, certainly a successful experience for me. So yeah.
The other little piece about acupuncture is, like, as Larry was saying, I liked how, Larry, you framed the mechanisms, because in part the traditional view is a view rooted in the historical context, because we didn't have the vernacular and the scientific understanding that we do today. And so I think a lovely part of acupuncture in general is that we can really clearly tell patients that, we're allowed to talk about your feelings, we're allowed to talk about body and mind medicine here, because this medicine comes from a time where those weren't really seen as separate. And so we don't provide therapy. However, it's a safe space for people to start to make connections between physical sensations they have and emotional things going on. And I really appreciate that, and I think that's an important place where healing comes from that isn't often, it's not incorporated or presented in some of the research that is being done. I hope we can have more mixed methods research moving forward, but that's just sort of a nice element of it all.
Just to make sure that everybody can hear this, Jane mentioned that she's gone through the cancer journey, and it seems like there are 4 parts currently to the journey in her experience: diagnosis, surgery, treatment, and then follow-up. She'd love to see that last part be a post-treatment recovery plan, including things like acupuncture, nutrition for healing, breathing exercises, craniosacral therapy to clear the body, etc. It's unfortunate to be told to go home to wait instead of really being given some terrific recovery options, as well as acupuncture during treatment for side effects. She had other knowledge from her experience in natural health care, but many do not know this. And I think that is part of our blooming mission as a program, to make sure that all of the patients that we serve have access to those sorts of options and knowledge, and a more proactive and holistic form of healing, not just, the importance of Western medicine in treating things like cancer is tremendous, right? But we are not just the molecules that need to be targeted. We are whole human beings with mind, body, and spirit. And boy, this group of people is the one that is, I think, primed to help infuse that into our healthcare as a whole. I think we're a little we're at our time right now, but I want to, deeply, deeply thank Larry and Kathryn and Kelly for their sharing their knowledge and the discussion. I know it ignites a flame of excitement to me as a reminder, like how much potential integrative health has. And yeah, thank you so very much to our presenters. Our grand rounds next month, it's a little bit in the works yet. What I'd like it to center around is the concept of ceremony and the importance of ceremony in our lives, the ceremonies that we may have lost or not had a chance to be a part of because of the pandemic, ceremony and celebration that we might be thinking about going into those holiday seasons, and the ceremony of medicine and healing that we all bring to our work. So if there's anyone that has an interest in that and would like to help in facilitating such a presentation, let me know. And then we'll gather next first Wednesday of December. Thank you all, and have a lovely, lovely month of November.